All right. Good evening, everyone. My name is Ayana Polk. I am the Director of Community Partnerships here at Vital Connections. We are a health equity systems change organization that brings everyone together in order for us to share information, tell our stories, and to make sure that we're connecting each other to the resources that we need to stay safe and healthy. So I just want to make sure that you all, as we enter into this, of course, we're bringing back our community convos. This is something that definitely got us through a number of medical hurdles over the past couple of years, whether it be COVID, food access. We're here to make sure that we're connecting the community with the experts to make sure that we have what we need. We're really happy to bring back our community convo series with Let's Talk About Long COVID. As we know, COVID, even though 2020 is far behind us, COVID has evolved and it's still with some of us. And we want to make sure that you all have the most up-to-date information in order to keep you and your family safe. So before we go into conversation, I want to make sure that we all talk about some shared language, get us a little refresher on COVID and how it can impact us all. So I do know one of our panelists, Hope White, did supply some information. So I'm going to give her the floor for a moment just to talk about, what long COVID is, just so then we all have a shared understanding before we get into the panel. Hope, is it okay if I pass it off to you?
Sure, that's fine.
Okay.
Thank you, Ayana. Welcome everyone. Happy holidays to everyone. I work at Boston Medical Center with a program that's called the Massachusetts Community Engagement Alliance. We are a program that is under the umbrella of NIH, which is the National Institutes of Health. And during the height of the pandemic, NIH funded 21 states around the nation to address COVID, especially in communities of color. As you all know, in BIPOC communities, COVID had the most devastating effects. There you'll find the highest disparities and the highest mortality rates. So our program was born out of that. As Ayana mentioned, COVID is starting to wane. Believe me, it's still alive and well, so don't get too comfortable. Still get your vaccines and boosters. But out of COVID, another illness has developed, which is long COVID. And wherever we do our education and our outreach, I always come across someone that doesn't know what long COVID is. So I'm going to give you a little bit of information. So what is long COVID? It's a condition that occurs in individuals with a history of probable or confirmed COVID-19. So you can't get long COVID unless you've had COVID. A lot of people have come up to me and said, Hope, I feel like I have long COVID symptoms. Do I need to see a doctor? And I would ask, well, when did you have COVID? And they said, I never had COVID. So I said, well, you can't have long COVID unless you've had COVID. So symptoms may be new following an initial recovery from an acute COVID-19 episode. That means you had COVID really badly. You may have had to have been hospitalized. You may have had to have taken medication. Symptoms may also persist from the initial illness, including patients who had mild or acute infection. So you can get long COVID if you had a very strong case of COVID-19, and you can also get long COVID if you had a mild case of COVID-19. It doesn't discriminate. Symptoms may fluctuate or relapse over time. So the best way that I describe long COVID is that you had COVID, you may have had a couple of weeks of feeling sick, not necessarily hospitalized, but you felt like severe flu, you were achy, you were tired, very lethargic. You might have had a headache, maybe some body aches. And then after 2 weeks, you start feeling better. Your energy starts to come back, your appetite. You can smell and taste again if you lost those senses. and you start to feel like your old self. About 2 to 3 weeks later, you start going downhill. You're getting tired again. You're losing your taste and your smell. Your body starts to hurt. Maybe you're having some severe forgetfulness. That could be signs that you're acquiring long COVID. So on the slide, you'll see that I have some symptoms listed. And so headache, just basic headache, doesn't have to be migraine level, but just a lingering headache. Body ache, I think we all have body aches. I'm getting older, I have a lot of body aches. But body aches, stiffness, something like arthritis, hurts to stretch, hurts to bend over. Fatigue, who isn't tired, who could sleep right now, okay? I'm making a point that a lot of people have these symptoms, which are very common. And so if you go to someone and say, you know, my body hurts, I've been tired a lot, I've had this cough, you really won't get much attention because these are very common. Most people you talk to are feeling this way. And so people really will not take you seriously initially. So fatigue, depression or anxiety, coughing, runny nose, loss of smell. Let me move this over. Loss of smell, taste, and then depression and anxiety. If you have these symptoms at a prolonged period of time, that's something to talk to your doctor about. Long COVID can grow and develop into something where you can be debilitated. There are stories of people that can no longer work, can no longer drive, can no longer take care of their children or their families. And so long COVID going untreated can really develop into something serious. So if you're experiencing any of these, you don't have to have them all at the same time, but if you're experiencing any of these, I would definitely speak to your doctor. Next slide, please. So at MA-CEAL, we said we need to do some type of education and intervention regarding long COVID. Unfortunately, long COVID now is most prevalent in communities of color. So we said we just can't have people walking around, not feeling well, not feeling healthy, and not know what's going on with them. So we created an educational program that's called the Long COVID Ambassador Training. It's a basic train the trainer model, which means we train community people to go out and educate other community people. Studies show that people are more receptive to getting education from people who look like them, people who sound like them, and people who live near them. So the train the trainer model is what we're using to educate different communities around Boston about long COVID. As I have here, it's community-based. And so we recruit people who already have some kind of community connection. We work with community health workers, health navigators, people that work with some of the Boston churches. We even have some students that attend BU and they're in a Masters of Public Health program who do some workshops for us. So it ranges, but the key is that you already have some groups that you're connected to in the community. We address long COVID and disparities in the BIPOC community. We also talk about social determinants of health. That's kind of like the buzz phrase these days, but it's a real thing. And it's a true barrier for people to get the care and the resources that they need. And so we try to make it a little bit easier for you. When you come to our training, you get paid. Time is money. And so it's a 2-day training, 9 to 1, 2 days in a row. You will learn the basics about long COVID. You will learn about symptoms. We will get more in depth than I have the time to do now. You'll learn about caretaking for a person who has long COVID. And you'll also learn about the different long COVID clinics that we have throughout Boston. A colleague of mine, Dr. Marathe, is going to talk about that And I bet you didn't even know there is such a thing as a long COVID clinic that only works with people that have long COVID. So as I said, you will receive compensation for attending the training. And once you're trained to be an ambassador, we will pay you every time you do a 1-hour workshop within the city. And so you're educating, you're getting a little bit of pocket change, and you're making a difference in your community. How can you go wrong, right? So we just had our 3rd training, and we'll probably be having our 4th training in January. After the holidays, after you get your celebrations in and have your fun, we'll be having another training in January. But I just wanted to let you know that long COVID is real. Be aware of your health, be aware of these symptoms. And if you've been feeling poorly after, having COVID for a while, check out yourself with your doctor and just don't suffer. We're not meant to feel bad. We're meant to feel good. And so I pray and, hope the best for you all. If you have any questions, of course, I'll be around. But thank you, Ayana.
Yes, thank you so much for that information. I know that I think that's a great place for us to start our conversation. And of course, I'm going to go back to the slide just so then everyone can take a look at it before we start. I think Hope did a great job with talking about what qualifies as long COVID and some of the symptoms that you could be experiencing. And as you can see, like Hope said, a lot of them are similar to a lot of the other bugs and other things that are floating around this time of year. So it's really important to check in with yourself and think about, hey, has it been a while? Have I experienced COVID before? What was that like? Are any of these symptoms reminiscent or remind you of them? So just wanted to share this screen for just a hot second before we get into our conversation tonight. But thank you, Hope. Thank you very much for getting us started in that way.
My pleasure. Thank you.
So again, I know we are here because we want to talk to our experts. We know that you all, I want to say, first of all, before we get started, that these are 4 individuals who have really been able to guide us through what COVID looks like. I know that each of them have done phenomenal work through the pandemic, and that's the reason why we're here today, to look at that information and how we can continue to monitor symptoms and the evolution of COVID so we can continue to stay safe. So just wanted to make sure that who is in the room tonight. I'm going to make sure that we introduce everyone individually as we bring them up to the virtual stage. Hold on one second. So, all right. So I want to make sure that we are bringing everyone up. So we first have Dr. Duong, David Duong from the Center of Public, forgive me, I just put it away. I'm sorry. Dr. David Duong from Harvard Medical School. He is the director for the Center of Global Primary Care. So Dr. Duong, thank you so much for joining us. I feel as though it's really important that you are cultivating our future doctors and, making sure that they are at the helm of some really great research. So thank you for joining us tonight.
Thank you.
Awesome. And then next we have Dr. Marathe from Boston Medical Center. She is the medical director of the Long COVID Recover Clinic. As you heard from Hope, who's also from BMC, they're doing some great work in the community to make sure that folks know that they have tangible resources and can be a part of the solution. So thank you for joining us, Dr. Marathe.
Thank you for inviting me, Ayana.
Yes, awesome. And then next, we have Dr. Sari Sanchez, who is the medical director of the Infectious Disease Bureau over at Boston Public Health Commission. So as you see, government is really important in how we navigate public health. And I'm really thankful to have someone who's been at the helm to make sure that we stay safe, because I know the city of Boston has done a lot of phenomenal work to make sure we are staying safe, healthy, distant, wash our hands. I know eons ago, I used to work for the city. So I used to hear those messages all the time. So it's good to meet one of the people who were behind, who was behind all that. So thank you, Dr. Sanchez, for joining us.
Thank you for the invitation.
And then last but not least, we've already heard from her, but we're going to bring her up to the virtual stage, is Hope White, who is the Director of Community Engagement for Massachusetts Community Engagement Alliance through Boston Medical Center. So Hope, I know that you work closely with the clinic. Of course, you share some great information, but thank you for connecting the dots between the clinical and community. So thank you for joining us here tonight.
Thank you again, Ayana.
Yes, all right. So now that we have our panelists up here and we're going to get into some conversation, I'm going to just set some kind of grounding rules about how the conversation will go. Of course, this is a community convo. People are here because you want to ask questions, you want to hear from the experts. So feel free, as we're in conversation, to put your questions in the chat. There is some time towards the latter half of the program where we're going to go through those questions. That's an opportunity to come off mute if you need to share your story, give some context. We're going to do that there, but we want to make sure that we give the first portion of the program just to kind of go into conversation, may answer your questions, or it may spark a new one. So feel free to use the chat. We have my awesome team member, Marky, who's monitoring the chat, and he'll be engaging during Q&A to make sure that we get your questions answered. So, of course, you know, we're here to ask the questions. I know I have a lot of questions. I was taking notes when Hope was talking, because I know I've had family members who've experienced COVID. Luckily, knock on wood, I haven't, but I do know through the season as COVID evolves, I want to make sure that I stay safe, right? And I want to make sure the people around me do. So, you know, let's just jump into it and let's talk. So, you know, thinking about 2020, when we all found out that our world was going to change, and you know, fast forwarding to now, what are the things that you've learned through your professional experience about the evolution of COVID? And are you aware of any new research that would help us understand what COVID is today? And anyone can jump in and start first.
Sure, I can take it. So if I understand the question correctly, you're talking about COVID-19 and not just long COVID, to see how far we've come along on the journey, correct?
Yes.
So when COVID-19 happened, the COVID-19 is the name for the disease, and the virus that causes it is called SARS-CoV-2. So the virus was first described, as we all know, from Wuhan, China, but then quickly spread worldwide. It is an interesting virus because, unlike the other coronaviruses, this virus seems to mutate rather quickly. And so if you look back, you had the first wave of COVID-19 cases, and then came Delta, and you had another spike, and then came Omicron, and we had the biggest spike of all of the, like since the start of COVID pandemic. And we continue to have variations of this Omicron strain, and it kind of is going up and down. And what the ID specialists and what we are hearing worldwide is, we expect that every winter we might see a spike in COVID-19 cases. And so when you're looking for lessons learned, we think it might become like a seasonal virus, something like flu, and continue to require vaccines. So you may need to be vaccinated once a year. We don't know yet, but that's where the science is headed. Also, since the beginning, we didn't have any treatments, we didn't have vaccines, And now we have both. We also know which patients or which populations are at risk for developing severe disease. And so the recommendation is to test early and treat early to prevent hospitalizations and prevent death. Because as Hope mentioned, people of color who work at the front line were at the highest risk of acquiring COVID-19. And we know that they are also at risk for getting repeated infections from exposure to the virus. And so keeping them protected and making sure that they are aware of the risk factors is a really important thing. And if, God forbid, if somebody does develop the infection, then we have effective treatments to enable you to recover quickly than what was happening earlier on in the pandemic. And I think that public health policy has changed a lot since that time as well. So I might give it over to Dr. Sanchez to chime in.
Sure. I mean, I echo a lot of what was just said, in that, it's really been an evolution of learning and adapting, right? I think that at the onset of the pandemic, and as lessons learned from other pandemics, especially those related to viruses, the public health priority, at least at the immediate onset, the urgency, right, was, to think about vaccines that we knew were going to be essential around preventing people from getting sick, but also preventing people from dying from COVID acutely, meaning when they get sick. And then also treatments that would keep people from getting very sick and dying. And so a lot of the research and kind of the immediate points were really honed in on keeping people from getting very sick and dying. And then, through those two main tools. And I think part of what and very related to this conversation, is as we've had more people get sick with COVID throughout the world, and people who get sick and survive and also have symptoms of longer disease or sort of more chronic symptoms known as long COVID, the research agenda has also shifted. And I know my colleagues here can talk a little bit more about that too, but now, there are even studies that sort of are trying to study not just treatments to keep people from dying or to keep people from getting very sick, but also treatments to manage potentially the symptoms of long COVID. And so we've really come a long way, I would say, from a public health standpoint. And I think that, we continue to learn, because, it has been just, now around 4 years since the virus first emerged. And so, we really are, especially in the long COVID realm, and again, others, we really are just starting, kind of continuing to learn more and more about what this disease entity really is and how to support people and treat people potentially.
Great. I would just echo what Dr. Sanchez and Dr. Marathe said, and just emphasize here that prevention is really the key. And we have great vaccines. They're nothing to be afraid of. Millions upon millions of people around the world, including here in Boston, have been vaccinated. And speaking from the primary care provider point of view, and also as a physician who works in the ICU, we really rarely see patients now in the ICU with COVID who are not vaccinated. So it's really just targeting those so it's really just hitting people who, and there's still quite a number of people who are not vaccinated. So just in general, for the one key take-home message today is, if you or yourself or your loved ones are not vaccinated yet, please go and get vaccinated.
Yes, thank you for that. So now that we've kind of talked about the arc of what brought us to here, and I know that we kind of had some grounding conversations about, what is long COVID, but just wanted to know, I know that there's a lot of, misconceptions about, long COVID and COVID-19, how to keep yourself safe. those kind of things. So I would say in your professional walks, all of you would love to, let me start with Hope, because I know that with your role, you're directly working with folks in the community and the ambassadors. But what are some I guess some myths that you might have heard in passing when talking to the community, or misunderstandings or misconceptions about long COVID?
I guess the one that stands out is that there is no such thing as long COVID. Something made up, kind of like the same sentiment that people had about COVID when it first came out. What people do know, and a lot of people don't know the basics of long COVID. Everywhere I go, as I had mentioned in my intro, everywhere I go, I come across people that never heard of long COVID at all. But a lot of people think that whatever it is, it's fleeting. It's just temporary, nothing to be alarmed about, really wouldn't have an impact on your life. And, they're healthy, they feel good, they work. It just doesn't concern them. People who have heard of long COVID had asked if there is medicine that they can take to get rid of it. When Paxlovid was becoming more popular, people would say, where do I get this COVID pill? They called it a COVID pill. And now they think this COVID pill is effective for long COVID. So can I use this COVID pill with long COVID? They're similar. Can I take the pill for both? But truly, the most things that people say is, what's long COVID? I never heard of long COVID. Yeah.
Well, I know that the research and the reason why we're here says otherwise.
Exactly. Exactly.
For the rest of our guests here today, are there any other myths or misconceptions that you might have heard in passing with talking to other folks in the community about long COVID?
Yeah, I'll start. So I see a lot of patients who come to my primary care practice, and some of the myths, or the more common myths that I've heard, are that long COVID is just a psychological issue, right? It's all in the head. And that's definitely not the case. It affects the body. It affects different organ systems in the body. So it's not all just in your head, and you're not going crazy for thinking that you have long COVID. And we see, there's been so much research on the different organs that long COVID could affect. Another common myth is that you have to have a really severe case of COVID to have long COVID. And I think that Ms. White really nicely addressed that no, you don't have to. And to establish a diagnosis of long COVID, you don't even need to prove that you have had a positive COVID test in the past, that you may have had symptoms, that were COVID, but there's no requirement that you need to prove to a physician that you've had a positive test or anything like that. So those are, from my practice, the two biggest myths that I frequently tell patients about.
I think related to that point, I would add that, oftentimes I'm asked, is there a test for long COVID?
All right, I think Dr. Sanchez
froze.
Yeah, it's okay. I think one thing we learned through COVID is how to do a Zoom. So that's fine. She'll jump back in when she rejoins. Dr. Marathe, is there anything that you have heard in your work that are misconceptions about long COVID?
Yeah, so one question that comes up from the long COVID patients is, am I going to have this lifelong? And the answer is, we honestly don't know, because we have quite a few people who have recovered, and we also have quite a few people who've been living with it for the last 2 or 3 years. I've also been asked very, very frequently if long COVID is infectious, and it truly isn't. You cannot give long COVID to somebody else. If you're living with elderly people in the house or somebody whose immune system is not strong, they're not going to get sick because you have long COVID. At the same time, I've heard that some employers may discriminate. So my patients are very hesitant about getting a letter that says, please excuse them from work because of long COVID, because they want nothing in that letter that says COVID, because they're afraid their employers will want them to stay home in isolation. But truly, long COVID is not infectious. You cannot give it to anybody else, regardless of what you do. And we don't know how long it lasts. It varies from patient to patient.
Awesome. Thank you for that. With this, it kind of has me thinking, right? And I know this was something that our team was thinking about. So I know Marky has a poll that we're just going to drop in the chat for you all. Would love to just kind of poll the audience to see where you are with long COVID. Just want to know, how much do you feel that you know about it, where it is right now and how it can impact you? So the question is, how much do you know about long COVID? And this is your personal opinion. So either you could put a lot, a little bit, nothing at all. It's okay. This can kind of help us guide the second half of our Q&A to make sure that we're really getting to the bottom of what you all would love to know. So I'm going to keep that going. Okay, I see a couple of responses. I see, some people know quite a bit. Know a little bit. Those two are kind of battling back to back. And some folks don't know much at all, which is fine. So really thankful that we're here to engage around this. All right. So I am seeing a couple more answers. I do see a lot and a little bit. So I know there is some knowledge sharing going around. So yes, thank you, everyone. So yeah, it looks like we've got like a pretty mixed crowd. So this is a great space for us to go a little bit deeper into, what we can all do to better prepare ourselves. I see that Dr. Sanchez is back. We were saying one of the things we did learn through COVID is how to deal with Zoom. So yes, would love to kind of give you a chance to complete your answer.
Sure. Yes, I'm not sure how much of my answer, but mostly that there's no test for long COVID. Really, I think a lot of people ask me about, is there a test I can take? And related to Dr. Duong's point, there isn't. I think that it really is, a history of symptoms and taking a history of what you've been going through that will really determine whether or not you might have long COVID. So no test for long COVID.
Awesome. Thank you. So I do see that there are some hand raised, some folks, of course, we put in the chat if you have any questions. You can either direct message them to Marky if you want them to be anonymous, or feel free to put them in the chat and we'll make sure that we get to you during Q&A. Thank you. So let's take a deeper dive into that. Now that we've heard some of the misconceptions of COVID, would love to think about some of the things that were shared here. So as long COVID is largely an invisible ailment, and there can be a disconnect between the findings and what the patient is complaining about. Just like we said in the beginning, there could be some symptoms that folks experience, could be a cold, and they might dismiss it as such. How are patients dealing with this frustration with or when they come to a clinic or a doctor's office? What are the conversations like with trying to identify long COVID during their care stay?
I'll start. That's a great question. I think that long COVID is could be a really frustrating diagnosis for patients. And the journey to get to a diagnosis could also be frustrating because in the medical community as well, amongst at least primary care clinicians, we're also trying to educate our primary care clinicians on the diagnosis of long COVID. And primary care is usually the first interface with the healthcare system that most of our patients interact with. So because, I think we've all been hearing that we're still learning about this disease, your clinician is also still learning about this disease. So sometimes, unfortunately, the onus is also on the patient to provide some education to their physician as well, or their clinician. I think that additionally, because it's a disease that has no diagnostic test, and most of the time, because of how general the symptoms are, fatigue, brain fog, possible palpitations, myalgias, or sore, like being sore, there's no good diagnostic test for those symptoms either. So a lot of the times, my patients at least come back extremely frustrated that, they're feeling these symptoms, they're experiencing these symptoms, and their blood tests or their laboratory tests or their radiology, their MRI or their CAT scan or whatever is normal. That is frustrating from a patient's perspective, and it's also frustrating from a primary care provider's perspective. And what I generally tell patients is that just because that these diagnostic tests are coming back as normal does not mean that you're not experiencing these symptoms. And let's work together. And I really think that working together and that therapeutic relationship between the physician or the clinician and the patient is really important to address. Okay, you may be coming in with a really long list of symptoms, from brain fog to anxiety to palpitations to muscle aches. What are the ones that are most debilitating for you, that is affecting your quality of life the most? And then how can we work together to address them through the therapies that we already have? And that's another important point of long COVID, is that at this point in time, we're targeting the symptoms that you have. Because we're still learning and understanding what's causing long COVID. So we're really targeting symptoms, and it's it takes a conversation and a really deep conversation with your clinician in order to do that.
So I want to piggyback off of that. So I know that conversation between patient and doctor is really important. And I know I think you struck a chord when you're talking about the advocacy piece. How can patients be better advocates for themselves in these situations when talking about long COVID with their physician, especially if they're in a space where they, with research and different, support tools being, released, every day, right? How can we, as folks who are not, clinical physicians, how can we make sure that we're having a well-rounded discussion when we're, coming for our appointments?
I'll let my other colleagues chime in.
Thank you. I can take that. So what is helpful is for the patient to actually make a checklist of their symptoms, because with long COVID, over 200 symptoms have been described, and no two patients are the same. So what long COVID looks like for one person may be completely different from another person. Memory fog is a very, very common complaint of long COVID. And so people forget to either tell us about their symptoms or forget the conversation we had about how to address it or navigate while living with long COVID. So the best way to do it is to make a checklist. So write down what your symptoms are, write down what the worst day for you looks like. Because like Hope mentioned, the symptoms fluctuate, and you may notice that one day you feel like your old self, and the next day you crash and burn. So we want to know how good and bad days look like, and what the severity of your symptoms are, and which ones are affecting you the most. So we can figure out a plan as to the best way to help you. Be patient with yourself. That is number 2, because like Dr. Duong mentioned, everybody is learning about long COVID, including your clinicians. So it's a journey, and we want to walk with you to help you feel better and get to the other side. With long COVID management, it may mean a trip or two to your primary care doctor, who then decides whether to send you to a long COVID clinic like the one that I run. There are several across Boston. Once you come to the long COVID clinic, be prepared for like a head to toe questionnaire, because we don't want to miss anything. And then it is followed by more specialized testing that is based on what your symptoms are and what we think might help you. Because even since long COVID was described, there are some techniques and strategies that might impact the symptoms. We still don't know what will cure long COVID, and there are still no FDA approved treatments. I cannot say, come to me, I'll give you a pill and you'll be all better. But like Dr. Duong said, we definitely know how to treat some of the symptoms, not everything, but at least the symptoms that impact your life the most. And so bring a friend or family member that you trust, who can be your listening partner and can also remind you of anything you may have missed, to tell your doctor about what you're experiencing. And that way we can help you with a shared decision to arrive at a point where you're comfortable with the treatment plan. And then again, once that plan is made, you have to be patient, because a lot of my patients do recover. It just takes several months for them to get there. So it's not an easy road.
Thank you for that. I think that was really helpful to kind of give us a snapshot of what it looks like to bring the family in on this, right? And I think it's really good, because it's like you're not just educating yourself as a patient, but your entire family, right? And I think that that's the best way that we all, stay best prepared. Yes, Hope.
I had wanted to share that I have long COVID,
Okay.
and I've had it, I would say, almost 2 years. I also have a chronic illness that's called lupus, which some people have heard of lupus. It's a little more popular, if you will, now. But I got very sick with COVID and was hospitalized for about 3 weeks. It took a while to really get back to my healthy and strong self. And after really feeling great, I started to declining, I would say about 4 or 5 months after. But then I had a little bit of a flare-up with lupus. And so lupus symptoms and long COVID symptoms are very much alike, with the fatigue, with the achy joints and body, the brain fog or the memory loss is what I have the most now. And when I started getting that, then I knew that I had long COVID. I'm closely monitored by my team of doctors because of lupus. And so I've never gone to a long cover clinic, but I'm getting the care through my own medical team. And some of the things that have been mentioned tonight, as a patient, I do feel frustrated sometimes. My health is strong enough that I can do what I need to do, take care of my son, work full time. But the brain fog kicks in. I recall having a business call on the phone. And at the end of the conversation, they had asked for my cell number. Could not recite one number. I couldn't grasp it at all. And that happens to me, not as much, but I don't know if you recall, or if you're thinking of something and it can be at the tip of your tongue and you kind of think, that doesn't happen at all. It's just total blank. I can look at my neighbor that I've known for over 20 years and not remember their name, or even people at church. I know you, I remember times with you, but I can't remember your name. So you go into, hey girl, how's it going? But for me, that's embarrassing. If someone had known me for all this time and they couldn't think of my name, I'd feel a little hurt. And so I try not to let that come out and just kind of go with the conversation and let it ride and try to make it as comfortable for both of us. But there are times when you just feel like, wow, what's wrong with me? I used to be like tight and sharp. So you feel frustrated with yourself. I know I have no control, but it's a horrible feeling.
Mm.
Yeah.
Thank you for sharing your story, because I know I think it's really important for us to know that some folks are not going through it themselves.
Right.
So thank you so much for sharing that.
Mm-hmm.
And really happy to see that you're receiving the care and you're working with a team that's providing care for our community.
Yes.
A big shout out to the Recover Clinic. I think you all are doing phenomenal work. But I want to pivot to think about the partners in the health ecosystem that kind of make this possible, right? And I do think about how our government plays a role in making sure that the public health ecosystem is alive and well. So would love to pivot to Dr. Sari Sanchez, just thinking about what BPHC has done from 2020 to now. I would just love to kind of hear from you, because I know that the commission works closely with clinics like BMCs, but just would love to hear about, what BPHC has done, and what are you doing now to continue to alleviate the stress of long COVID on working individuals and the folks that are in Boston every day navigating our many neighborhoods. But we'd just love to hear some of the work that's going on over your end.
Thank you. I think a lot of our work has often, I like to think of different buckets, right? And I think a lot of our work often comes into listening and engaging and partnering. I think we've participated in sort of in different conversations around long COVID, such as the one tonight, because I think I really appreciate, and I know many of my colleagues do, just listening to kind of what are the questions that are out there that our Boston residents have, right? I think that knowing kind of what are like the most pressing or what things are not known, right? We can never assume. And I think that's something that I've learned to be humble in public health. And so I think really being present at these conversations is one of the first steps. I think we often do a lot of work around education and sort of trying to find ways, for example, through the Mayor's Helpline, where we can connect residents to the appropriate resources. And so, here in Boston, we're fortunate at BPHC to have BMC and many of our partner healthcare institutions that do have clinics. And so really trying to ensure that we connect our residents when asked about where are sites where they could get care, and just the fact that long COVID exists and that they should get they should get evaluated and potentially referred to trials around treatment is important. And then, I would say the other pieces has also been conversations with our healthcare provider. We're often asked, what are kind of, and I think a lot of what we hear too is the need for, kind of how this information is also disseminated more broadly. So for example, what are the languages that our communities in Boston speak, and where are, how can we match those to providers who can care for patients speaking those languages, and to resources, like what, brochures. So that's often been a lot of, I think we try to do a best that we can to connect residents to resources and our healthcare institutions to our residents, and vice versa. So I'll pause there. I hope that was helpful.
Yes, thank you. I know you all are doing great work. So it's just good to kind of hear how everyone's kind of working together, right? But I want to pose one more question before we open up the Q&A, because I know we received a lot of questions ahead of time. So I definitely want to give time for us to kind of go into them. But we're just, and this is of course just for everyone. When we're thinking about long COVID, let's say that Patient comes in, is diagnosed with long COVID, or they're experiencing those symptoms without being formally diagnosed. What are some things that individuals are entitled to, or some things that they do have to their avail? I know that there are clinics available, they can get that care, but what's involved in that care?
I can take that. So basically, does everybody need to be seen at long COVID clinic? The answer is no, because not everybody has severe symptoms. If discuss it with your trusted clinician, your primary care physician, and figure out where you're at in your journey. If you're living with mild symptoms that don't really impact your life on a daily basis, then maybe you don't need to see a specialist because all of this adds time, takes away from your family, takes away from your job. So there's the consideration of whether you actually are going to be benefited by going to a specialized clinic, right? So for most mild symptoms, you may not need to, and you could continue to see your primary care clinician. However, if you have moderate to severe symptoms that are impacting your day-to-day life, then I would advocate for them to be seen by a specialized center or a clinic for a variety of reasons. One, you're going to get comprehensive care because it's not a single man's job to be able to treat long COVID because it spreads across so many specialties. So these clinics will give you access to like lung doctors, heart doctors, neurologists, behavior therapists, speech therapists, occupational therapists, like whatever you need, that clinic is equipped to provide comprehensive care. The second thing is that, as we have pointed out before, long COVID is a new disease with no treatment modalities that are successful till date. So most of these clinics are engaged in cutting edge research. And if that is of interest to you, research is always voluntary. So don't think that if you go to a specialized clinic, you will have to participate in research. That's not the goal. Research is voluntary, but these clinics allow you that opportunity to decide for yourself whether you want to participate in that research. We do have several clinical trials at BMC and across all academic centers in Greater Boston. And the trials are also specialized. Like some are using Paxlovid, some are using like rehab therapies, some are using cardiac therapies for people predominantly with heart symptoms. So there's a lot of opportunity to decide what is right for you. And these clinics are the best way to do that. And then the last thing to go to these clinics is because under Americans Disability Act, if long COVID symptoms are so severe that you cannot do your day-to-day activities, you may qualify for disability. The disability exams are still done by disability physicians across Massachusetts, but at least these clinics will help you determine whether that is the right thing for you and help advocate on your behalf if that's what is needed to help you with your health care.
Thank you for that. Anyone else want to add to that? See, Dr. Marathe, you just do so well. You're so thorough that we're all just like, yes, we agree. Thank you. Thank you so much for that. So I do know I've seen quite a few questions in the chat. And like I said, we've got a bunch that came in ahead of time before before our conversation tonight. So I am going to call up to the virtual stage my colleague and our Vital Connections scholar, Marky Antonio. He'll be here guiding us through the Q&A. It was very instrumental to putting this together. So I just want to say, Marky, thank you for all of your hard work.
Thank you, Ayana. No. It's I'm grateful to have been able to present the opportunity for all our lovely speakers here to be able to speak about long COVID, especially for those of you who have remaining questions on long COVID. Rest assured, this will be recorded. If you have some family members or relatives or friends who are not able to attend, and we'll post this on YouTube very soon. But first, I want to express my gratitude to our speakers. Thank you so much for answering the questions today and for doing it so thoroughly. But to start it off, I wanted to give this space for anyone with any questions to ask. Leah, I know you've had your hand raised for a while. Would you like to unmute and ask your question directly?
Yes, please. Thank you for calling on me. I have a few because I, was trying to get my vaccines. And then when I got my second vaccine, I got a bad blood clot. I almost lost my hand. So after that, of course, I haven't had any more vaccines. So I don't know. My primary care physician never said, because I finally got off the blood thinners and everything. They thought I had AFib. Of course, that opened up a whole can of worms because they didn't want to admit that it was because of the second vaccine. But we know really it was. So I haven't received any more vaccines because of that. So I don't know if I'm able to get a vaccine again or anything. That's my first question. And then, like my husband, he got COVID April 3rd, 2020, when it first ever started in the beginning. He had long-term COVID. And I kept telling the physician assistant, because I said, there's something wrong with him. He's not getting any better. His mind is all messed up. He can't remember nothing. And so he had that fog for 2 years. Now I have my neighbor who has had long-term COVID. She had COVID. She got in January. She's been so sick. She's never been herself. She had to sell her car. She can't go back to work. Now she goes and sees her primary care. But from what I'm hearing, it sounds like she might need to go to a long-term COVID clinic. That now that I know that there are long-term COVID clinics. So I'm gonna put myself on mute and let them answer.
Thank you so much for your question, Leah. So regarding the vaccines question, I think that it will be very difficult for any of us here to comment on your particular situation, since we don't know your complete medical history or the situation surrounding the vaccine. But this is something that I would raise directly with your trusted clinician and share this with them, and then ask them that question.
Thank you. Okay, I'll do that because they have not, recommended me to have any more. So I stay masked up. I don't wear the gloves, but I don't even have to go out anymore because of that. I do not want to get sick. I've had COVID twice. And I didn't even both times I wasn't even out the house. And I don't even hardly have company. So it was the weirdest thing. I had to be in the hospital because of gallstones. They said, oh, you have COVID. So, thank God I haven't gotten really, really sick, but I don't want to have long-term COVID. I'm watching my neighbor, what she's going through with it, and she's miserable, she's depressed, everything.
Thank you for having the courage to ask the question, Leah, and to ask a question for your neighbor as well. I just wanted to flag that Dr. Sari Sanchez had to leave, unfortunately, but we still have 3 amazing panelists here to answer your questions. Please feel free to directly type your question into the chat, or if you prefer, it would be anonymous, message me directly. One next question I had, which was messaged to me directly, so I think the speaker would prefer to have it anonymous, is her understanding is that COVID-19 remains in your body forever. do we know if the virus will act like chickenpox and return/erupt when the immune system weakens?
So chickenpox is caused by a different virus that does stay in your body forever. SARS-CoV-2, the virus that causes COVID-19, does not stay in your body forever. So we do not think that it will wake up down the road and cause problems. However, there is a hypothesis that maybe the virus-like particles after infection somehow mess up your immune system so that it gets all revved up, and that can present as long COVID symptoms. So there is this hypothesis that not the actual infectious virus itself, but some of its proteins or some part of the virus may be around. It has not been shown, but it may trick your body into behaving as if you're trying to fight something off or cause problems with your inflammation. Does that answer the question? Hopefully it's not confusing.
Yeah, if anyone has any more further questions on that, please feel free to type in the chat, or if the participant who asked that question still has further questions, please feel free to unmute or just directly message me. But if not, I'll continue on to the next question. Christine, did this answer your question? If you would like to unmute and ask the question directly too, please feel free to do so. But Christine's question on the general chat was, can long COVID go away, or can it be for a lifetime? Dr. Marathe, I believe you answered that question earlier. Yep.
The long COVID can go away. I have several patients. It's slow. Most people recover by the time it's like 1 year into their symptoms, but I definitely have people who have lived with it for the last 2 or 3 years. So it looks different for different individuals, but it may not be for lifetime for every single patient, so to speak.
Thank you so much, Dr. Marathe. We have another question from Leah. Do you think that with having the long-term COVID, they should go to a long-term COVID clinic?
Yeah, if the symptoms are impacting, I believe you said it was your husband and your neighbor. So if their symptoms are so severe that it's impacting their day-to-day activity, like you mentioned, not being able to drive or not being able to do a lot of your daily chores and stuff, then I feel, yes, you should talk to your primary care and see if they can refer you to a long COVID clinic.
Okay. She went to her doctor. It just took them, first of all, of course, a long time to figure out that was what was wrong with her. But I'm saying for them, just for her to have more understanding and to better understand, because it is killing her emotionally. She used to have her own business. She used to dress nice. She had a beautiful garden. She cannot do any of that stuff anymore. And it's bothering her emotionally. So I just am concerned about her very much. We're very close neighbors. That is going to break her down emotionally. I don't want to see that happen to her. My husband, thank God, after 2 years, he finally got his memory back better. But he's younger than her, too. So I'm sure age probably has something to do, because it does with the way we get well. But she changed doctors. This doctor doesn't know any, as much. So what her doctor did, they put her on physical therapy. They gave her someone to help around her house, but that's once a week. I just feel like if she maybe goes to a long-term clinic, y'all should be better equipped to help her with all those things.
Yeah, she
Instead of
can certainly request a referral if you talk to your neighbor and see if that's what she wants for herself, and her primary care could refer her to a long COVID clinic.
Okay, so you'll have to have a referral to go to a long-term COVID clinic?
Yeah, more frequently than not, it's an insurance requirement as well. So not knowing what your neighbor might have, that would be the safest bet. I think Shakira did share the long COVID clinic resources PDF in the chat.
Well,
And
I did, so thank you. Okay, cool.
yeah, so there's a whole bunch of different clinics across Greater Boston, because some patients might have closer connection to one institution versus the other. And we've listed how to access those. So definitely like reach out, get more information, and go from there.
Okay, great. Thank you so much.
Thank you, Dr. Marathe, and thank you to Dr. Robinson for pasting the files onto the chat. We have compiled these resources also in our own Vital Connections Long COVID resources Google documents, and we'll share that out with all of you in a follow-up email following this event. So rest assured, we have those all in one place. I have another anonymous question for the panelists. I have had long COVID since September and have consulted with a neurologist and 2 cardiologists. We might be making some progress targeting POTS-like symptoms, but does it make sense to get involved with a long COVID clinic if I'm not fully improving? What are the wait times like for getting into those?
So the wait times are long. And they can be really long, ranging from a few months to upwards of 1 year. I would say that if you are already getting appropriate care from a neurologist and cardiologist, then have an open discussion with them. In my experience, all clinicians recognize their own limitations in knowledge, given that it's such a new disease, and are very open to, like, having a frank conversation with the patient and what the patient's journey looks like. And then once you've had that, if they can refer you to a colleague, or if they say, no, I think we are on the right track, I've discussed it with so and so, because we learn from each other. So it is quite possible that they may be able to reach out to their own sphere of cardiologists instead of making you wait for that long, and still be able to give you the best possible treatment. Because again, there isn't a proven therapy that works consistently. And so it's going to be driven by what the patient symptoms are and what you're experiencing, and how, if you're recovering or not recovering. So I would definitely talk to them first and see what their recommendation is. Sometimes they will say, oh no, I think it's great if we can get a second opinion. Or if they reach out to one of the long COVID clinics and see if you're eligible for a study, I definitely have had referrals, not for us to do a clinical evaluation for the patient, but to accept the patient in a clinical trial. And so depending on what is right for you, your specialist may be able to advise you the best.
Awesome. Thank you for that answer, Dr. Marathe. Another anonymous question we have is, what are you seeing in the pediatric population? Are you seeing connections with long COVID and dysautonomia with seizures?
I'm an adult infectious disease physician, so my knowledge is quite limited when it comes to pediatric long COVID. Having said that, we know that children can have long COVID. The percent of children who suffer from long COVID is very small compared to the adult population. So in adults, about 7 in 100 suffer from long COVID. And in pediatric patients is usually like 1 or less than 1 in 100 that suffer from long COVID. So there's a big difference. Some of their symptoms do overlap, the most common symptom that we hear about is that their schoolwork suffers and they develop behavioral problems. Seizures and so on, I don't know the data on that as much, so I don't feel I'm the best person to necessarily comment on it. And then POTS is usually uncommon in pediatric age group, but they certainly could have other manifestations like a racing heart rate or something. But again, I probably am not the best person to answer that.
Thank you, Dr. Marathe. We have another question in the chat. Sophia, would you like to unmute and ask your question directly, or I can just read it out?
Hello, good evening, everybody. My name is Sophia. So I just wanted to know, is RSV the same as COVID? Because it's something new for kids also with the cough, and we don't know what more about it.
Yeah, Sophia, that's a great question. RSV is not the same as COVID. They're two separate viruses. So yeah, but it's very similar. They could be similar symptoms in terms of fevers, chills, cough, aches, but they're two separate viruses, and it is not the same as the virus that causes COVID, which is SARS-CoV-2.
Thank you.
Awesome. Thank you, Dr. Duong, for answering that question, and thank you, Sophia, for asking. One other question we had, and it's related to sort of the longer term consequences of having long COVID, is can I apply for disability because of long COVID?
Yeah, so you can apply for disability with long COVID. It is recognized in the Americans with Disabilities Act, and that is a conversation between you and your healthcare provider, which is, and that could either be your primary care provider or a provider at a dedicated long COVID clinic, but you can apply for disability with long COVID.
Thank you, Dr. Duong. And pivoting entirely to the beginning of our panel questions and our panel discussion, one question we also had come up is, why does long COVID last so long? And I understand we talked briefly about the research, summary of the research on COVID and then long COVID following it. But one participant we had wanted to ask a very specific question on why it does last very long for some people.
I can start, and then Dr. Marathe can chime in. The answer is we don't know, and we're still trying to figure out the answer to that question. As we study the virus and how it affects the body and why it affects certain people differently, there are proposed ideas. So Dr. Marathe said, used the word hypothesis earlier, which is just a way of saying that these are rationales or why we think something is happening, but we have not proven it yet, and it's not fact. It's just our best guess, basically. And those rationale or our best guess is, as Dr. Marathe said, one guess is that it is a result of some of the proteins that are from the virus, that they can kind of stay in the body for a little bit longer, and that tricks the body into a response that it thinks that it's having an infection, but it's not having an infection. It's just responding to those proteins. Again, that's a guess. Some people who are for example, have previous infections with other viruses, such as the Epstein-Barr virus, or otherwise known as EBV or mono, as we commonly know about it, that could predispose them to having the symptoms of long COVID. Again, that's another guess. Another guess could be that our body could already be in an inflamed state, meaning that it is already, because of other diseases that we have, such as diabetes, or such as lupus, or such as other types of autoimmune diseases, or diseases that cause the body to be inflamed, that predisposes people to long COVID as well. But again, the short and skinny of it is that we don't know why long COVID lasts for a longer period of time and why it lasts for, 6 months in some populations, a year or 2 years in other populations. And these are just our best guess.
Yeah, I agree. I don't think I have to add anything to that.
Awesome. Thank you, Dr. Duong, for answering that question. Sophia had another question in the chat. Would you like to unmute and ask that question yourself, Sophia?
So as I'm learning about the long-term COVID, do you still have to isolate yourself, and for how long?
That's a great question, Sophia. And as Dr. Marathe said, long COVID is not infectious. So you can't pass it on to other people. So you do not need to isolate yourself if you have a diagnosis of long COVID.
Thank you for asking that question, Sophia. And thank you for answering, Dr. Duong. Another anonymous question we had pop up is, we have perhaps answered it, but the speaker wants it clarified. How do you know you have long COVID and how is it cured?
Yeah. Again, a really great question. So unfortunately, we don't have any tests. Like, for example, if you go to your doctor and say, do I have diabetes? And then they can give you a test. Then they can say, yes, you do have diabetes, or no, you don't have diabetes. Unfortunately, with long COVID, there is no test that is that simple. So it's going to be a conversation between you and your healthcare provider. And usually that happens after you've had the infection already, whether that's confirmed with a test or not confirmed with a test, but you may have just had symptoms, as Hope talked us through. And then usually it starts, the clock for long COVID, some people would say starts at the 4-week mark after the initial infection. So you have an infection, and then 4 weeks later, if you're still having symptoms, or if you recovered and then now you're getting symptoms again, that's when we start looking into long COVID. Long COVID is what we in the medical community would call is a diagnosis of exclusion, which means that we have to work through a list of all the other possible diseases and illnesses that it could be, and then we land on long COVID. So the process takes a while to figure out, and you will go through testing. So it will be a conversation and a journey. And I really want to emphasize that it's a journey to get to a diagnosis of long COVID between you and your primary care doctor or your healthcare professional. It's not going to be that you go into the clinic and then you leave and people are going to be confident to say, oh, you have long COVID. It might be suggested at some initial visits, and then it's going to be a conversation back and forth with multiple visits in between, and likely testing as well, whether that's radiology testing or blood testing. And then to your second part of your question about, is there a cure for long COVID? There is not a cure for long COVID.
Thank you for answering, Dr. Duong. As we have minimal time left before the end of this event, we have space for one more question. And this question is a bit more complex than the other question, is a bit more complex, I believe. It's an anonymous question. What has the government done, and what can they continue to do to relieve the stress of long COVID on working individuals?
That is a very complicated question. I think that the first thing that our government has done is that it's recognizing long COVID as a disabilities. And that is really a big step forward to say that this is a disease. We're still trying to figure it out, and people can take disability for it. Another thing that the government has done, which Dr. Marathe is a part of, and my institution at Brigham and Women's is also a part of, is that the government is funding research for long COVID so that we can understand the disease, we can learn more about it, we can get appropriate therapies for it, and they're also helping to allow us to treat patients and see patients with long COVID. So off the top of my head, those are two things that the government has done at a national level. And then we heard from Dr. Sanchez that at the city level, the the mayor's hotline can always be reached, and people can call in with their questions, and that's how the city knows what the needs for the city are, so that they can then inform healthcare institutions like BMC, like Brigham and Women's, Mass General, etc., so that we can provide more services as needed. So those are kind of like the top 3 things in my point of view, but I'll pass it over to my colleague, Dr. Marathe.
Yeah, so no, Dr. Duong covered most of it. What I would add is Representative Mindy Dom, who's a MA representative, as well as Ayanna Presley. They are strong advocates for long COVID and support for long COVID patients. Ayanna Presley, along with a few other senators, is trying to pass a bill that will provide easier access and support for patients living with long COVID. In addition, what the Health and Human Services Division of the government, federal government, has done is it provided funding for running not just therapeutic research where we try different treatment modalities, but it's also funding things like Community Engagement Alliance, that HOPE represents, where we are trying to engage communities in conversation, provide education, handholding, and access to care and resources. Additionally, HHS also conducted its own research, and it has come out with a long COVID action plan. I wouldn't bore you with the details, but it has several different aspects to it. So it has healthcare and how to provide care, how should the clinics be designed, and how to make it easy for patients to access. There's parts on policy on how the government and the local public health institutions should think about long COVID and support for patients. There's also place for patients' voices to be heard, because long COVID, the term itself, was a patient-coined term. So an archaeologist in London who did not recover after her COVID-19 infection, she actually hashtagged long COVID for the first time on Twitter in 2020, and it went viral, right? So long COVID is not a medical term, it is patient-coined. And so all of the definitions for long COVID, input into everything surrounding long COVID, A to Z of long COVID, is being driven by patients and patient advocates, including your clinicians and policymakers. So we've come a long way, but there's still a lot to be accomplished. And I feel like we need to join hands and be together on this journey to enable us to do that.
Wow, thank you. I think we're getting close to the 7:30 mark. I know we could be here all night, but I just want to say thank you all. Thank you, Dr. Marathe. Thank you, Dr. Duong. Thank you, the Miss Hope White, for coming in and teaching us about where we are now with long COVID and how we can protect ourselves. I know that we've had a very engaging chat. We've had a lot of questions. I know some folks ask questions around some resources and how they can continue to navigate the field when it comes to long COVID. So just remember, thank you to the BMC folks who put the information in the chat for us all. We're going to make sure we include that with our resource list that we're going to share out as well, because we want to make sure that you're leaving with some information that you can continue to engage with your community, inform the people who need to know, and use it for yourself to know who's in the room. Learn about these clinicians and these different spaces that you can go to start having those valuable conversations about long COVID, especially in this season where so many people are susceptible to so much. So before we all go, I know we always love to see how we can continue to make these community conversations bigger and more impactful, we're going to drop a link in the chat. This is just to ask some questions for you all, so that way we know what you want to hear about, and give us the feedback that we need to make these bigger and better for our community. So with that, on behalf of Vital Connections and all of the folks who make our work possible, I just want to say thank you for coming out tonight, and we look forward to seeing you at our next community convo. And a huge thank you to our experts who have come tonight to share knowledge. Last but not least, I want to say thank you to Marky. Marky has done a great job with convening us, asking all the questions, even running some of the behind the scenes in Zoom. So, Marky, our scholar, our future doctor, I just want to say thank you so much for all of your help too. So with that, have a good night, everyone. Make sure that you fill out the evaluation, and we look forward to seeing you at the next community convo. Take care.
Thank you, everyone. I hope Santa's good to you.
Yeah. Happy holidays.
Happy holidays, everyone.